The Montefiore International Program is a program that reaches children and adults who have very complicated illnesses from all over the world. Maiar's case in particular was very interesting to us.
Maiar is an interesting child from Libya who was actually referred to the hospital Necker in Paris, which is their big pediatric hospital for France, for a referral for what we call a melanonic lesion of the skull. Actually a quite large one, probably the largest ever reported.
It left her with a large hole in her skull through which her brain was expanding outward as it grew. And it also left her with very fragile coverage of her scalp. So a very tenuous position, certainly for a 15-month-old, but really for anyone.
So this is the model that we've actually constructed from the CAT scans from the child. So you can see the face here, the mandible. So we're turning now to the right occipital area. This colored area represents the area of the brain that's actually herniated out through the defect. And the plan is going to be to remove all of the skin and nevus around this lesion. And then Dr. Garfine will be taking the flap off of the back, which is vascularized and will be used for the reconstruction. Just so you can get a better appreciation without the lesion. Again, you can see the facial orientation and then the side orientation. And this actually is where the bone just didn't develop because the brain is actually physically herniated out through the hole.
Dr. Goodrich and I do a lot of children each year who have craniofacial disorders. In her case, it was such a unique problem that we also needed to get the expertise of Dr. Garfine. Dr. Garfine specializes in what's called microsurgery. And what microsurgery is a technique for taking tissue from one area of the body, moving it to another area of the body, and then connecting the blood vessels under the microscope. So very, very small arteries and veins under the microscope, reattaching those. So when removing her nevus, she was going to be missing scalp, she was going to be missing bone, and at that point she had exposed brain. Where Dr. Garfine brings expertise is he was able to take a muscle and skin from the back and then be able to put that onto the skull. And the only way to do that, and to take that much tissue successfully, is to have the ability to reattach it to an artery in the veins.
The harvesting of tissue in a 2-year-old doing this is extremely rare and technically quite difficult. I mean, it's a challenge for the plastic surgeons to get enough tissue and maintain its vascularity, maintain its viability, and that's really the key.
That was the first portion of the case. Then Dr. Goodrich came in and did his part, which was technically incredibly demanding and very, very high stakes.
My job was basically to get the lesion off because the child had a large bony defect like so, where the bone never formed over the top of it. And the lesion was all melanotic all the way down to the brain itself.
In her case, the mole was actually, or the nevus was involving the structures of the brain, so Dr. Goodrich really had to be very careful in terms of being able to peel that off and take that off successfully.
Maiar has been discharged from the hospital and remains locally in housing provided by Montefiore, and that housing will leave the family very close to the hospital so that we can keep a close eye on Maiar for the next several weeks. And so taking into consideration the differences in culture, the differences in housing, the accommodations, food, all of the things that one has to consider when transplanting a family thousands of miles away from home, we took all of those things under consideration and provided an environment for not only the patient to do well and to heal, but for the family to participate in that process.
We summarized all the care that we give for the international patients in 2 words, which is love and teamwork. We love the families that come here, and we give them the best that we can as a team together.
We do more craniofacial cases than any other program in all of New York. It has clearly become one of our crown jewels, and the sophisticated medical care that can only be provided here at Montefiore is the reason why Maiar and her family traveled thousands of miles to the Bronx for this sophisticated surgery.
I thought a lot about Maiar's case over the past few weeks, and the feeling that comes up most often is how lucky we are to have the privilege of intersecting with someone's life. Now, Maiar won't remember us, but her parents will. It's a real privilege to take care of Maiar and to have them put their trust in us here.
This is a marathon, not a sprint. She will need multiple surgeries over the period of months, but we are very confident that the most complicated and most difficult part of the surgery is behind Maiar, and the future looks very bright for her and her family.